Hello, this is Angelia, and you're listening to or watching the podcast, Why You Do What You Do, the podcast that talks about human development and psychology to maybe help you figure out a little bit more about why you do what you do. And last time we were talking about the disease model of, looking into abnormal psychology. And some mental illness can be classed as a disease, like, alcoholism, and addictions, and bulimia and things, but in general most mental illnesses are not a disease. So there's some problems with the disease model, and we're going to pick back up on that. Accepting the disease model has another consequence that is quite independent of its conceptual quality or its final validity. This approach makes the diagnosis and management of abnormal behavior the more or less exclusive province of the medical profession. And now most of your GPs or MDs are not versed in psychology, except for a tiny little bit. Say that they're not, as qualified as a counselor, a licensed counselor, or a social worker, or a psychologist or psychiatrist are going to be. So you're not going to get the best care if you stick with your MD for a mental illness. Sorry, MDs, don't get mad at me. The argument runs something like this. Abnormal behavior is the result of some organic disease process. Physicians understand and know how to diagnose and treat disease. Therefore, physicians are the only or the best ones to understand, diagnose, treat, and manage abnormal behavior. Now, again, we know that's not necessarily true. We know from back in the day when they had the sanitariums that, some people just cannot be helped that way. Zaz and other critics of this view contend that the medical profession's vested interest in the continued existence of mental illness makes them the least, not most, qualified judges of abnormality. And again, like I said, most of them aren't steeped in it. When you study psychology, you're steeped in that. That's what you know. I was comparing my education to a person who was going to a university. We had the same books, but he was having to take English, history, all that other stuff. And I was in the career program where I didn't have to take all that stuff. All I was studying was psychology. So, I prefer it that way. Physicians tend to see only the disease, not the person with the disease, thereby neglecting such critically important considerations as the patient's attitude or acceptance of a dependent role, for instance. The absolute model. Perhaps the oldest approach to determining the criteria of deviance is to use moral absolutes, such as those of various religious doctrines. Virtually all organized religions provide a set of rules for behavior, strengthened by the presumption that any violation is sinful in the eyes of God and will surely be punished. The problem there is that you're not God, so, you can just go on what you were given, and there's some problems with some things we're given. It might not be verbatim. There are people who, oh no, every word is true, and it's like, meh, but I know some things. Although the rules vary somewhat in each religion, this model has a great impact on how society views particular behaviors, and that varies from society to society. For instance, masturbation and homosexuality have long been considered abnormal in Western cultures because they violate the Word of God as stated in the Bible in the Old Testament. And again, we're not supposed to be living in Leviticus or Deuteronomy or any of that stuff. because we're supposed to be living in the New Testament, if we're Christians. And yes, he did say go to the priest and all that stuff. And that's why Catholics have confession. They go and confess their sins and get absolution, which I don't think anybody but God can give you. But again, each culture is different and has different beliefs. The field of abnormal psychology. Abnormal psychology has emerged as a field of study out of all these and many other attempts to understand abnormal behavior. Because people, what is wrong with them? We do that. What is wrong with them? And, sometimes, something ain't quite right there. But, you just don't know what that quite is. The field's major concerns fall into three general categories. Number 1, defining abnormal behavior in terms of recurring patterns or symptoms. Because, like people with OCD, they might have to tap on something several times, or they might have to do something a certain number of times before it's okay. There are other people who have to do a certain behavior over and over again at a certain time in a certain way in order for them to feel like their life is in control. So that's a good example of that. Explaining the development of such behavioral patterns with an eye toward possible prevention. And that's where psychotherapy comes in. Why did this person develop these behaviors? Well, usually OCD is about control. So that means at some point they felt out of control. That there was something in their life that they felt was out of control. Could have been a death in the family, could have been a divorce, anything like that when you're a kid that can knock you off balance. They developed these behaviors to feel that they were in some sort of control of their environment and their life. Managing the behavior for both the individual concerned and others who must cope with it. And that's something that, is your reality. If you have a loved one who has a mental illness, you got to deal with it. So, sometimes you need some therapy. Sometimes you need to go talk to somebody and say, this is, driving me nuts. So, there are a lot of things to think about when you're talking about mental illnesses. As we examine various psychological disorders, we will consider each problem in terms of these three categories. So, defining, explaining, and managing. Those are the big three when it comes to treating mental illness. You have to define what it is. You listen to the symptoms, behaviors exhibited, and usually you have an idea. Okay, well, I think this is this. Let's look into this a little bit more. Then explaining. You get them, to tell you what happened, why they started this, when did it start, why do they think it started, and then, maybe you can lead them to a point where they can see how this started, and then managing. A lot of mental illness can be managed with just talk therapy. Some need medication. Some are not manageable, period. And those people have to go away from society because they're a danger to themselves and others. And that's a shame, and that's the far end of the spectrum. Let's first make certain that the issues themselves are clear by looking back at three opening cases. How do we decide that Arnold, Elaine, and Tommy are to be regarded as abnormal rather than as normal? And if you weren't watching that first one where we got into this, Arnold has schizophrenia, Elaine has anxiety and depression, and Tommy is autistic. So, how can you tell that, their abnormal behavior is not normal? Each of us knows people with peculiarities or eccentricities. Are Arnold, Elaine, and Tommy significantly different from them? Well, Yes. You know, if you just have quirks that don't hurt you or anybody else, that's not a problem. If you have behaviors out on the street that might keep you from being effective at your job, or maintaining a job, that's a problem. If you are exhibiting behaviors that keep you in your house, where other people have to take care of you, that's a problem. And if you are certainly banging your head against the floor, that is a serious problem, because that is a danger to you. Defining behavioral deviance sets a dividing line between behavior that is considered within the bounds of normality and behavior that falls outside those bounds. And remember, we talked about the survival test. Is this behavior deviant enough from your survival and in whole that of the species that it's a problem? And if you're doing something that's detrimental to you, then that's a problem behavior. As we have noted, this line is set legally by legislation, morally by various religions, and historically by customs. And like I said, each area has their own customs. In the final analysis, it is also set personally by each of us in terms of the impact that the behavior of others has on us. And we all know people, I'm sure, that have impactful behavior towards us. And that's no fun when somebody's spilling their own little garbage on you and you're like, you got the WTF face on. So, that's something that is noteworthy. Thus, the answer to the question of what constitutes deviance is almost always relative and always changing. Because what one person sees as abnormal, another person does not. There are folks who I consider their behavior to be very abnormal going on right now. But they think it's perfectly normal and even good. And I'm like, where did you grow up? Who taught you this? Did you not go to school? I mean, did you not listen to anyone? Did you not have a decent person to teach you how to be a decent person? But, like we talked about that bell curve, sometimes the norm is not good. The question of explaining abnormal behavior in our three cases is equally complex. Were Tommy, Arnold, and Elaine born the way they are? Or did they set some set of events or experiences cause them to go off the track? Now, Tommy is autistic, so he was born the way he is. Arnold is schizophrenic. Now, he was born with that genetic propensity to be, but it usually doesn't kick in until middle age. So, he probably eventually kept sliding down to that point. And Elaine could probably has a biological component for depression, but it seems like situational issues have increased her depression and anxiety, so she more than likely has two things going on, the biological and the situational. Are they behaving strangely because of bad genes? Possibly. Or are biological and nutritional deficiencies involved? This list of questions could easily be continued, but the point should be clear. There is no single answer to explain abnormal behavior, because everybody's different. Everyone's life has been different. Even people, twins, even have different takes and points of view on the way they grew up and the lives that they've lived. And they can even have different physiology enough to where one would get a certain disease and one would not. So there are many possible answers, none of which suit all cases and none of which are universally accepted. So, one size does not fit all when it comes to psychology and in medicine too. A lot of doctors don't believe that. but that's the case. Even the kinds of explanations that are preferred, both by professionals in this area and by the society at large, change from time to time. Like back in the olden days, you had manic depressives. Well, now that's bipolar. So, things change. The final issue is management. Elaine, Tommy, and Arnold are indeed disturbed, and there are some reasonable explanations for their disturbance. And I just basically laid them out. We could simply ignore the behavior and segregate the affected individuals from the rest of society, like they did back in the 1800s in the sanitariums. Or we could actively work to change the abnormal behavior, which is what we try to do through psychology, with psychologists, psychiatrists, counselors, social workers. The form of management we choose usually depends on how we explain the cause of a behavior, because if little Tommy who's autistic, you're not going to send him to a psychotherapist because that's not going to do any good. You're going to send him to probably a vocational therapist who can help him stay physically aware of where he is. Maybe a speech therapist, depending on the situation. So, again, all types of things don't go. Now, your Arnold guy, he's going to have some psychotherapy, and he's going to have some med management. And Elaine also should have those. That's her family's not doing that for her, but they should be. That is, if we believe the behavior results from the presence of a devil, then the treatment will involve getting rid of that evil spirit. Like, back in the old days when, especially if we look at the medieval times where everybody was being possessed. So, if we believe that overwork and stress have caused the behavior, then rest and quiet is the treatment that will be chosen. In general, there are a lot of people who go in hospital for stress. I know of some people, and there have been times in my life where I've thought about it. Limitation of the field. Ideally, then, definition, explanation, and management are closely related. Those big three that we talked about. Establishing a pattern of symptoms leads to a theory of etiology, or cause. And that theory, in turn, suggests an appropriate treatment. So, like I say, if it's a physical thing, they're not going to treat it the same way as it is a mental thing, or, a combination of the two. For example, the discovery that amphetamines can be useful in treating hyperactive children was accidental. And I know that. One of my children was given caffeine by a doctor, and then later on a medication. And it calmed him down, so it does work. I mean, it works on them the opposite way of what it works on everybody else. But the success of this treatment gave researchers the idea of seeking a biological basis for hyperactivity. So they figured that out on accident. They probably gave a Coke to a little hyper kid and he calmed down. I don't know. But sometimes accidents are good. Once a biological cause is identified, the problem is no longer classed as a psychological one. Because if you can treat it physically, then there's no need for it to be treated as a psychological illness. When the behavioral disturbances due to vitamin deficiencies were clearly identified, they became routine medical disorders treated by a general physician, not by mental health specialists. So again, the doctors look to see, is there something physical here? And if there's not, then that's when they refer you to a mental health specialist. When penicillin was found to destroy the microorganisms responsible for impairing brain function in syphilis, this disorder also became treatable as an ordinary medical problem. Because with syphilis, with the spirochetes and all that, you go crazy, and they just think, oh, they're crazy. But, once they could diagnose that, then you could get treated and, you wouldn't be that way. Since abnormal behavior has existed as long as human beings have, you might expect that most disorders would have been explained by now. Yeah. Just, again, every society's different, so what one blames one thing for, the others might not think so. As far as we can tell, the incidence of psychological disorders has been fairly constant throughout history. So, it's not just something new that psychologists came up with. There are records from the past that say this person had this, that, or the other thing. They gave you different names through the ages. So, I've heard people say, I don't believe in them brain doctors and they just make it up. Well, no, they don't, because as long as people have been around, there have been recordings of people being not quite right. Most forms of psychological disturbance have turned up in all parts of the world. So again, it's not unique to any one society. Where differences do exist, they often appear to be due to diagnostic practices or to the degree of social acceptability of a particular disorder within a given culture. And there are certain cultures that think these are special people, that they're different, and that means they're blessed and they should be, listened to and revered. Yet explanations and treatments still vary according to the prevailing social, religious, and scientific beliefs. Nor are the most scientific cures always the most effective. Rituals designed to drive out demons have had impressive success rates in cultures where evil spirits are viewed as the cause of abnormal behaviors. It often appears that the most important factor in a patient's recovery is a belief in the treatment. So, if you believe the treatment is working, it's going to work for you. And if you don't, then it's probably not. So a lot of people set up roadblocks to their own recovery because they dislike this person or they have a bad attitude about authority figures or whatever. So they block their own recovery by copping an attitude and not believing that this is going to work for them. And that keeps them stuck where they are because, I can guarantee you each and every one of you is unique, but you're not the most unique person in the world. So, with some disorders, total recovery is possible. The patient resumes the former level of functioning and goes home to a normal life. And that's 90, let's see if I can remember, 97 point some or other cases. So most of the time, you're not labeled crazy and thrown into an institution. Most of the time, you're going to get your help and you're going to get recovery and you're going to go back to a normal life. In other cases, partial recovery or arresting the progress of the disorder is a more realistic goal. And that's for your more severe mental illnesses that need regular management. The person may have to continue medication or psychotherapy indefinitely, and even then may never regain all the abilities needed to be self-sufficient. And there are people, who have this problem out there in the world. In some instances, the most that can be hoped for is to help the person as well as the family and friends involved adjust to the problem. Because, like I said, if they have severe schizophrenia, they're out of touch with reality, they're having hallucinations and things, therapy is not going to help that. There are medications to help reduce that, but ultimately, if they're pretty far out there and, they really can't be in touch with reality, then there's not a lot that people can do about that. It is for these reasons that we have chosen the term management rather than cure or treatment as the third phase after describing and explaining a disorder. Because, like I said, sometimes things cannot be cured. Sometimes they can only be treated, and sometimes they can only be managed. So that's the differences there in the limitations of the field of medicine and psychology. So that's where I'm going to leave you for today. I hope that helped you figure out maybe a little bit more about why you do what you do. Please like and share this educational program, and that's what this is, an educational program. It's not designed to diagnose or treat any mental illness. If anything in here triggered you or made you think that maybe you got something to think about there, then by all means, please talk to your mental health professional. If you want to help me out, subscribe to my YouTube channel. And if you want to help me out even more, go to my Patreon page and become a patron. Thanks for listening or watching. That's all for now. Until next time.